the Republican plan to replace Obamacare passed by just the slimmest of margins. 217 Republicans voted for the bill, just one more than the 216 they needed. 20 Republicans voted no. And we have one Republican, on each side of the bill now here with us to dive into what just went down. Joining me first is Republican Congressman Chris Collins of New York, who voted for the health care bill this afternoon. Congressman, thank you so much for joining me.
Good to be with you, Katie.
I want to ask a little bit about the process here.
Sure.
When health care was first being debated, when Obamacare was first being debated, there was a lot of talk about not being transparent enough. Take a listen to what your leadership said back then.
I don't think we should pass bills that we haven't read, that we don't know what they cost.
We're left with party line votes in the middle of the night, a couple of sweetheart deals to get it over the finish line, and a truly outraged public.
And look at how this bill was written. Can you say it was done openly? With transparency and accountability? Without backroom deals and struck behind closed doors, hidden from the people? Hell no, you can't! Have you read the bill? Have you read the reconciliation bill? Have you read the manager's amendment? Hell no, you haven't!
You know, you could just change their names, and I feel like I could hear exactly the same criticism coming from Democrats today. What's the deal, Congressman? There's no CBO score on this bill. This was a party line vote, a slim majority at that. Sweetheart deals, we had the Upton amendment, $8 billion yesterday after Upton met with President Trump. 50% of Americans are not confident in this bill. It sounds just like what your Republican leadership said back then.
Well, I couldn't disagree more, Katie. In fact, we've been working on this bill for over 6 years. Ever since Obamacare came in, we have been passing bills and marking up bills that then came together into what we now call the American Health Care Act. But this was not done over a 2-week or 3-week period. This has been 6 years of hard work, as we knew Obamacare would fail, and failing and failed it has. Also, we have a CBO score saving well over $100 billion. Sure, there were a couple of tweaks at the end. We'll get a final score that may, knock a couple of % off of that, but we're comfortable that we know there's huge savings, and by the time the Senate is working with this, we will have the final score. So savings over $100 billion, guaranteed cost savings when it comes to premiums of 10%, a bill we've been working on for years. So this is so very different than what happened with Obamacare. And of course, we had a party line vote. There is no way Nancy Pelosi was going to let a single member of her conference vote to repeal Obamacare.
It wasn't just a party line vote, though. There were a number of Republicans. 20 Republicans voted no on this. 20 Republicans.
Yeah, so we had 93% of our conference on board, 93%. And we're talking about states like New Jersey, California, and Pennsylvania, which are entirely different than Mississippi, Louisiana, Florida, and Texas.
Do those Republican voters not matter in those states?
Well, when you say that, no, everyone matters. All politics are local. We did have 20 members for one reason or another, some from the Freedom Caucus, some from the Tuesday group, and some not in either group. But we had 93% of our conference come together on a bill that had no support from the Democrats, but it was a campaign promise the president made and every one of us made to replace the failure of Obamacare, where today 94 out of 99 counties in Iowa don't have an insurance carrier at all.
Part of the reason is because of the lack of confidence in Obamacare, because of the way that Republicans have gone about gutting regulation and also saying that they were going to repeal it. Part of the reason that there is only one health care provider or no health care providers is because of the insurance markets and insurance providers pulling out because of what Republicans were, the rhetoric they were putting forth, and what they were doing.
Katie, you can't say that. They pulled out when they thought Hillary Clinton was going to be elected. This didn't happen in the last 4 months. You go back a year ago and you look at what happened in Arizona. That was with President Obama and the expectation that Hillary Clinton would be elected, and they were down to 1 only one insurance carrier in Arizona, and even yet later during the year, others pulled out. So no, this was the abject failure of Obamacare. It has nothing to do, and you can't say that they pulled out because a few months back we elected President Trump. You can't connect those.
What do you say to the AARP, to the American Medical Association, to the American Hospital Association, all of which have said that this bill is not one that's going to protect those with pre-existing conditions, it is not going to protect the elderly, they're concerned about it, it's not going to protect the poor? What do you say to them? Are they wrong in their assessment?
Yeah, they're absolutely wrong. Clearly, they have not read the bill. Again, we're talking about
Have you given them the time to read the bill?
Well, sure. I mean, our bill's been out there for over a month. There's been a few amendments that just came out. They're very small amendments, by the way. So if they did not read it, that's of their own doing. And clearly, when you look at pre-existing conditions, those folks are covered. They will continue to be covered. And this is, again, some exaggeration that just is not based in any reality that I'm living in when anyone would say we have disadvantaged someone with pre-existing conditions. First of all, anyone who has insurance will continue to have insurance. So those who may have had a pre-existing condition that got insured under Obamacare continue to have that coverage.
I have yet to see a single piece of analysis that says the $8 billion Upton Amendment is enough to make sure that those with pre-existing conditions in states that do choose to get a waiver and are approved for a waiver, that is enough to cover all of the patients that might have pre-existing conditions. Have you seen different analysis than I have?
Yeah, certainly do, because let's talk about what it is. These are not people that are currently insured who have catastrophic health conditions like cancer or heart conditions. So what are we talking about? The individual exchange, which is only 7% of America. It would have to be a state that opted into the waiver. We're not sure any states are going to opt in. And if they did opt in for the waiver, this would have to be a person who currently is not insured, someone who is subsequently diagnosed with cancer or some other condition. And then what we have is money to backstop the extra cost that could be charged in a waiver state for a maximum of 12 months. That's the most it could be charged, and we've got money into it to cover it. So anyone who has actually read the bill will see that we are protecting those individuals who currently don't have insurance, who live in a state where they might have a waiver and then would have to pay a higher cost for up to 12 months. We have the money to make sure that they would not be paying it. It would come out of that pool. So we have absolutely protected those that subsequently will be diagnosed with a pre-existing condition, because those that currently have it are already insured, and that continues.
Can you 100% guarantee that, yes or no?
Yes.
Thank you very much, Congressman Collins. Appreciate your time, sir.
Okay, Katie, always good to be with you.
Absolutely.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.